Welcome to the Caddo Convos, the podcast that explores the vibrant community of businesses thriving in Caddo Office Reimagined. We're here to shine a light on the incredible entrepreneurs and professionals who make the most of our private offices, co-working spaces, and day office rentals in the Dallas-Fort Worth suburbs. Join us as we share their stories, celebrate their successes, and dive into the benefits of working in a space that's close to home but offers so much more than working from home. Let's get started with today's conversation. Join me in welcoming Brittany Blackman with the Hope and Health Medical Clinics. So let's just jump right in with, what are the benefits you provide to your customers?
Great benefits I provide. A lot is my availability. I know it's really tough for people to get into their providers to get seen for any issues, be they chronic or acute, needing a more immediate assistance. And so I have more time and space available for those to be taken care of in a timely manner for the patients to be more beneficial to them.
Right. So as a customer, it's all about you're available to me.
Yes.
Right?
Yes, via the phone or getting a telehealth medicine, or just coming into the office and really getting to take the time to hear what the problem is, hearing maybe what you don't say as well, and just addressing the thing in full.
What makes your company stand out compared to others in your niche?
For me, I would say that it is the compassion and the time that I give for my patients, because that's the main complaint that I hear all the time from people. They're like, my provider spent less than 5 minutes in the room. I don't feel seen. They didn't really listen to what I had to say. And I feel people's pain about that. And I really want to hear them, number one, because that's how I'm going to help know what your exact problem is and how to help you fix it. But then also just that you feel known and understood, and that we have that trust. The bond of the practitioner and their patient is very important, because I need to know what you're going on. You're not sitting on the puzzle pieces, so I can see the full picture and help you as best as possible.
So talk to me about your journey to getting into this career, to become a provider of health.
Yes. So, I'm being in medicine technically for 20 years and going from the lower points of a CNA to a bedside nurse. But as I was there, I really noticed a lot of people don't know a lot about their bodies and what to do about them, how to help themselves, really how their bodies function in general. And so I really started to burn about wanting to step up into a higher rung of authority and to be able to help in that specifically. So to be able to delve further into their lives and help them with those things. And so becoming a provider was the next best option for that, to be able to help in that way.
As a healthcare provider, what problems are you trying to solve when treating the whole patient?
It's very important not just to look at the medical condition that people come with, because our bodies are connected. We're the mental and the physical are all more than one thing.
Right.
So getting to delve into that for the patient. Also their social things as well. It's like if people aren't getting enough sleep, people aren't getting enough from their relationships, people are, they're stressed, they're tired, they're anxious, all these things are going on. That's going to affect your body physically as well. So even simple things people taking care of, like, you need rest. Your vitamin D is low, and so taking care of that, which also can help their mental health as well. Just getting to see, gathering all the pieces so that a person can help take care of themselves to the full, their optimal level.
So Brittany, you're here at the Caddo Maple Shade location. What's great about being here?
This is an awesome office. Besides I guess people call it the feng shui, it's a super cute space. I really love the manager, Tara. She's very personable, kind, very sweet. The offices themselves are excellent. I love the space. Being a new entrepreneur, not necessarily knowing about pricing of things, I feel like this is awesome for, a overhead, for everything kind of being more of a bundle situation. And you have other staff that are here, I guess, to help you with situations like the front desk, who are there to help field or people, whoever to come in. But also it's nice to be around other businesses and generally just other people. It's nice to not completely be on your own by yourself. Just to have the interaction, walking around with people in the lunch area, and everyone here is very respectful and very kind. People say hello. And they have all the kind of benefits. They have the kitchen area, you can get your mail here. Parking's great. I really love the building, the establishment.
Excellent. Have you looked at any other campuses within the Caddo? I don't know. At this point, there are 9, to my knowledge.
Yes, there are several. I visited the Lakewood one, which I liked but I wanted to come here first. And I've also seen the North Plano one as well. That one was also cool. It's a different vibe on the inside, but those are just fun how those change around. But this one for the area and location was my best option for the time. But I hope to be able to expand, actually, if it's possible, to get offices and clinics in other Caddo spaces. So that would be great.
Excellent. What is it patients don't seem to understand about themselves that you can treat?
Their need for checkups, really like super primary prevention. A lot of times I hear for people being like, oh, well, I feel fine, and I don't have any problems. I haven't been to the doctor in multiple years. But then I hear their history, or they're like, man, my mom had this and my dad was sick with this. Also my grandpa and my aunt and uncle and stuff. I'm like, okay, so let me give some education here. It's like that, your dad had heart issues at 50. Your mom had, breast cancer at 40 something and she's not doing well, like these kind of things, that means you need to be in the office earlier than that. There you have a propensity to have possibility of medical issues, and primary prevention is to help to stave those things off, to notice them before they get to a point where it's starting to be detrimental to your health. It's like, if you're healthy, cool, come get your annual physical, get some lab work. Hey, you're good. Bye. See you next year.
Right.
Hey, next time, or hey, I found something. This is what this means. Let's see ABC to help it out. And you're still good to go. So it doesn't, cultivate into something that's a problem even further down the line. So people taking care of themselves, really, or understanding really what that means, as far as help being, the medical community being beneficial to them.
Right. I think a lot of us forget that an ounce of prevention, right?
Yes. People, just even the smallest things of taking care of themselves. You're like, I didn't realize, like, hey, do you sleep? It's like getting the proper amount of rest. Hydration is vastly important, and having good fuel sources, which is, eating things. Those 3 things can affect you so immensely. And if you're not taking care of yourselves in those kind of ways, and then it starts to domino, effect in that manner. So ounce of prevention.
So is there a certain type of age group that should really be aggressively addressing prevention, or is just everybody?
Really everybody, especially a lot of people don't necessarily know their family histories of things.
Oh, good point.
Yeah, which is, good to know, definitely. Put that in your notes page, in your phone, ask your mom what your family history is so you can just know it or have it on hand. But really probably the 30s, 40s, you can definitely have something done before then, having your labs done, because I guess people of that age or feel like they're fine more than other people. And that's also the age, especially in the 40s, we're starting to get into, hey, we need to start checking you for colon things, or we need to start checking you for your breast exams, your mammograms, all this kind of stuff. And it's like, well, I've been fine this whole time. Now I'm kind of not. I'm like, yes, well, let's head off at the pass,
Right.
kind of thing. So.
Yeah, it's like with the dentist. If you have a toothache, you waited too long.
Yes,
when
exactly.
you feel pain, you waited too long.
Yes, people do that a lot as well. People ignore things, or they make an assumption like, oh, well, my back maybe is hurting and this is weird, but it'll go away. I'll just, people rub some dirt on it and keep going, which sometimes you just, maybe some over the counter things or treatments can be helpful. But other times, it's like, hey, just get a professional set of eyes on something. And if it's fine, it's fine. If not, then we can take action, and that's just an important difference. So with letting something fester.
Tell me a typical patient story. I know you got a lot of different patients. So walk me through kind of the journey of a patient with you.
Like a new patient, or just in just?
I think let's start with new patient. What's the new patient journey for you? Let's say I just found you on the internet.
New patient, I'll want to do an intake. Get your family history, your personal history, what's going on with you, so that I can get a good picture. And then after I get a picture of that, I want to see if there's a specific reason that you came in today. It's like, this is going on. I have this kind of a pain, but then I get to look at the backstory that you just told me and get to start to put the puzzle together. It's like, oh, okay, well, your stomach's bothering you. Okay, well, you said you've been having issues with this and this food, so I start to just create your care plan of what I see that you might have needs for, or changes to be made, or certain medications to start or stop, or kind of adjust what you need tailored individually to that person and go from there. And it's like, hey, we might need a follow-up depending on what I find or what actions we initiate. And like, hey, come back in 2 weeks. Hey, let me see you in a month. I'll see you in 6 months. Well, depending on what we find and what we collaborate on together as patient and provider of what's the best for them. So that's for a new patient. I would say it's similar for an established person as well. I already know what their
you'd already gone through the new patient experience.
Yes, and so when they come in again for the follow-up, I generally already know what they're coming in for, or hey, you're coming in for like lab follow-up. Hey, I found this, come talk to me. You're already on this medicine. We're going to change this. We're going to adjust it. Hey, this is good. You're doing great on this. We're making improvements like we wanted to. Good job. You don't have to see me as much anymore, or whatever adjustments need to make. So it's great because then I already have the relationship, the rapport established and stuff, and we can just carry on with what the patient needs directly. So that's cool.
What is the best way to contact you?
Really, I'm contactable by my the office line. I have an email. Let's see. I also have a Facebook page and an Instagram.
Okay.
So you can be messaging on all of those.
Excellent. We'll put all of those in the show notes. So if you want to reach out to Brittany, just check the show notes on any of the platforms that this can be found, and she'd love to hear from you. So Brittany, again, thank you for being here today. We're both Brittany and I are in a Caddo Maple Shade location. The podcast studio is here, and Brittany's just upstairs, and I can wave at her most days.
Yes, we have the same windows.
So again, Brittany, thank you for being here. Really appreciated this time with you.
Thank you so much. I really love the opportunity to get to share this and have this experience. It's been awesome.
Thank you for joining us today on the Caddo Convos podcast. A huge shout out to our incredible network of members for making our community vibrant and supportive. If you're looking to boost your productivity and reduce the isolation of working from home, consider joining us at Caddo Office Reimagine. Our spaces are designed to meet your evolving needs, support remote work, and foster a sense of community that's hard to find at home. Whether you're a startup aiming for growth, a freelancer seeking a professional setting, or a company looking to optimize resources, Caddo offers a perfect blend of flexibility and innovation. By joining us, you'll be a part of a dynamic business ecosystem that helps you thrive. For more information, visit caddooffices.com. Thanks for listening, and we'll see you next time on Caddo Convos.